So, do you prefer me calling you the delegate here?
No.
Okay.
I don't.
No.
I prefer you calling me Lorig. You're sitting in my house eating my pie.
Yes, all of that. Hello everyone who lives in State District 20, Maryland, which means you likely live in White Oak, Silver Spring, or Tacoma Park. This video is for you, because we knocked your door, and you privately shared with us on a microphone what you wanted our representatives to work on. So here is the response back from one of your state representatives, Delegate Lorig Charkoudian. This is the last one.
Okay.
All right. So I'm going to read this one because I had taken it just from the notes itself from the podcast. So I said, many constituents who did not record their voices for you to hear spoke about healthcare. I didn't get a single one really speaking about it on air, but Jay mentioned how his parents were impacted by pricey insurance. And then there was another person. There were a lot of healthcare providers in this area.
Yeah.
One nurse, T, shared that she saw a 70-year-old person have a stroke because they didn't have health insurance to help pay for the medication they needed and were rejected from programs. And another constituent talked about she was currently uninsured. She was young, like me, maybe like 4 years older, like 26. And she said she was struggling to find out how to find good health insurance in general after she could no longer use her mom's health insurance. And those were kind of the three broad categories of problems people talked about: being uninsured, watching people be uninsured as a healthcare provider. People talked about themselves being uninsured or having to pay really expensive insurance and maybe choosing, like you said, between rent and insurance. And then people talked about also, like, how do I find it? How do I use it? What is good health insurance? And how do I find it affordably?
Yeah. So you want me to do that in like 3 seconds or less?
You can do it in whatever.
Right, so another area where there's like multiple layers, and it is something that really we should be fixing at the federal government, at the federal level. Until then, there's things that we have and need to continue to do in Maryland, but I think it's one of those ones where, we made some progress under the previous administration, under Obama, and needed to keep making progress. And instead, of course, as everyone knows, we're headed in the backwards and dismantling the protections that we did get. So in Maryland, I think there's the Maryland Health Exchange. And so if folks who don't have insurance haven't been there, they should. Okay. And that, that's a website, and they can find out about what's available, what could be subsidized based on, whether they're eligible, potentially if they're eligible for Medicaid, whether they're eligible for other subsidies, those kinds of things. And so that's definitely a place people who don't currently have insurance, they should look at. Now, it's possible folks went to it, they looked, and they felt like they couldn't afford the options that were there for them, but that's definitely a place for people to start. Then beyond that, there were proposals last year that I supported that didn't pass, but that basically created sort of an individual mandate in the state. And the way it was supposed to work was that if the way the mandate worked, that if you didn't have insurance, you paid a fine basically on your taxes, and when you paid your taxes, or a fee, I guess, or a penalty, whatever people want to call it, I guess. Depending on what we called it, is why we got it through the Supreme Court. But but I can't remember what the technical, which one it is. But anyway, so you pay that. But the Maryland proposal, which I thought was really cool, is when you pay that, it goes into an account for you and serves as a down payment for when you do get to purchasing. So you're not just paying it into a general fund. So it's really sort of pushes you towards having insurance. Because of course the issue with insurance is the more people who have insurance, the more we cover folks, the more we're spreading the risk. And that didn't pass. I did support that. I hope it comes back this year.
And that technical piece you were just talking about, Lorig, you would get that fine or insurance, not fine, penalty, and it would pay into your future buying insurance.
Right.
That's really cool. Yeah,
it's a very creative idea, right? Yeah.
It makes so much sense.
It does, because what we want is not to take money. We want to get people insured, right? So you're trying to line up the incentives, and in this case, the fine is part of the incentive. But ideally, you're just back to what we were talking about, restorative approaches, like not just punishing people, but like actually meeting the goals that we have for our communities, which is to have everyone insured. Sure. Okay. What did pass this year is, one of the things I think folks know, and maybe people talked about, is you could have insurance and such high deductibles and co-pays that prescription medication can be so costly. This is where people are picking between paying for their prescriptions or paying their rent. we did pass this year. The original bill was a prescription drug board that would monitor and ensure that you didn't have price gouging in the state.
Okay.
The compromise that passed ended up being that is in place just for state employees, state and local employees, the insurances that are under for state and local employees. But the hope is that prescription drug, the affordability board, I think is what it's called, that is able to... we can model what it can look like for a limited number of people, and then potentially expand it. So, so it's and here's the thing, and I think everyone knows this, and we sit around scratching our heads, and I think I have some answers, but I won't go into them now.
Okay.
Why is it that the exact same drug is available in Canada and in Europe, and it's 10 times as expensive here, right? But the answer is because it can be, right? Because we have decided that it is okay to have, unbridled capitalism with no regulations at all in the healthcare world, and in other places there is capitalism, but there are regulations that protect people within that, and so that's the issue, is to start really looking at how do you have regulations around things that are life and death. As medication is.
And that board is working on that, and that was legislation that passed.
Yes, in this limited way, and hopefully eventually it'll expand, so it'll be everybody. So those were two big pieces of legislation that passed that have the potential to expand. I'll mention the one that I'm working on specifically is related to medical debt. So one of the issues that's come up is that we have hospitals in the state, including charity hospitals that have nonprofit status, that are required to have financial assistance programs, that are suing the heck out of their patients, their low-income patients. The people are going into debt on sometimes healthcare bills as small as $500, $1,000. They're being sued. They're being sued on healthcare bills that are as small as $500 or $1,000, but they just don't have the money. And then, of course, once they're in that debt, and then there's it snowballs, because then you have interest rates and fees, and then then you're in court, and folks end up, and I talked to one woman who actually went to the wrong court on her court day, and so then a body attachment, which is a warrant for her arrest, got put out. So literally you have a woman who got cancer, and now she has been arrested because she couldn't pay. It is so absurd that is the country that we live in. And so then people lose their homes, people, she ended up straightening it out, and she didn't spend a long period of time, but she was spent several hours in jail because she got sick. It's crazy. And so people lose their homes, their wage garnishment.
Did she also, I may have missed it, but did she get some of her wages garnished, or anything else happened beyond
I was the focus of the conversation was, we were talking about body attachments, that part of it, the fact that if you don't show up in court on a civil case, it's a body attachment, a civil case, you could get arrested. I assume all those other things happen. We were focused on that piece of it. So anyways, the legislation that I have, among other things, says you can't have, for medical debt, you can't, judge can't sign a warrant of body attachment. But also it limits, my legislation limits the, it adds more time before, if somebody is still going through appeals with their health insurance company, the hospital can't sue them. Because you're still waiting for your health insurance, that could take 6 months, and in the meantime you've been sued, so you may even end up getting it paid for by your health insurance, but meanwhile you're in court and you're accountable for thousands of dollars so there's things like that. There's things like you can't take a lien out on somebody's house. That's in my bill. It limits garnishment on wages for folks 200% of the poverty rate. So there's pieces in there that sort of put some guardrails around making sure that our most vulnerable low-income families or middle-income families aren't just financially decimated because they got sick. So that's that is it's not specifically I think what folks ask for, but it is kind of sometimes with or without insurance, people end up in that kind of debt, and then it just destroys everything else. So I do have that legislation I'm bringing in this coming session.
So, but everybody is looking at, then you mentioned at the very beginning, on the federal, it's everybody's looking towards the federal for something universal if they're looking for something universal.
Yeah.
Okay. There is no like, this is how we're trying to bridge that gap. There's how we're trying to make sure that the worst things don't happen to people, like, for example, the medical debt or...
Right, well, I think, in theory, we could, in theory, Maryland can set up whatever it wants for its insurance markets.
Okay.
Right? So we could do Medicare for all here, we could do single payer here, we could do a public option here. But because Maryland is relatively small,
okay.
Some models, Medicare for all, for example, which could work at a national level, or a public option, which could work at a national level. And I've read some of the math, and I think you could potentially find a way to make some of them work at a state as small as Maryland, or regional. Sometimes people are looking regionally. Could we do it with other states? But it is much more difficult to do at a state or even regional level.
Yeah.
That doesn't mean it can't be done, but I think it's much more difficult to do. I would fully support it. I don't think that there's organizing now around that. And
there's
it would
hope
be
at the federal or something. That's what people are so hopeful for.
Right, I know. Let's see what happens, next year. And, yeah.
Okay, you wanted to end on your MGA note.
Oh, yeah. So for folks who don't know, the General Assembly, the session starts. So a lot of people, to your point, like don't necessarily know kind of what our work looks like, and so we have a 90-day session where we consider 3,000 bills, somewhere between 2,500 and 3,000
bills.
Yeah, it's pretty awesome. It's intense, but here's what I will say about it. Because of that, and we all have one staff person. They're part-time off session, full-time during session. It's a ton of work, and it is. And so what I like to stress for constituents is how important their involvement is. I think people think a lot about the federal government. That's what we kind of see more in the news, but people aren't always thinking about how much actually does get affected by state government policies.
Yeah.
And
states can guarantee rights.
Huh?
States can guarantee rights.
Yes, and people need to come and ask for what they want. So I'm thrilled to have this podcast. I also want would encourage people to if people were willing to get on my email list, I do send weekly updates of like what's happening in session, what's going on. Right. It's at the beginning of the session, it's weekly, and then maybe it's like more like a week and a half.
I was just comparing the other updates I get from other legislators. Like, weekly's impressive.
Just during session. Not like people don't necessarily want to hear from me weekly off session. But during session, just because things are moving so fast. Thank you. My Facebook is for that. But I also would encourage people to just come to Annapolis. We do, District 20, we do a District 20 night. And maybe you could let folks, that you're connecting to. So we do District 20 night. Yeah. And last year we arranged transportation. So some people drive, but then we also arranged, last year we did pickups in...
carpools and stuff.
We actually paid for vans to pick people up. We had people up in White Oak. It's a pickup in White Oak, in Four Corners, and in Tacoma Park, I think is where we ended up doing it.
You guys had a grant for that, or you guys pulled your money?
No, we paid for it.
Wow.
Yeah. We feed people too. Okay. But so come to Annapolis. And I think one of the things that I want people to see is just kind of how... you should know where laws are getting made that affect your life, and say come and take a look. And then people will come, they'll have dinner, we'll talk. And then usually we do it on a Monday night, and Monday nights we have session at night, so people can then watch from the gallery and see the session taking place. Yeah. And so that also, any other time, if people can get themselves to Annapolis during session, my office, come say hi. And I have snacks for everyone in my office. Coffee.
Yeah.
I do. Yeah.
That's good. Yeah.
But if people are interested in working on an issue they care about, I think it's really important. I think it's I think that they're, as with any government body, paid lobbyists and corporate influence, it's just very easy. People have folks there full time doing their lobbying for them, and residents can also show up and tell their reps what they care about, but it's harder to do that. And so whenever I have a chance to encourage people to do that, I like to do that.
Come,
So, yeah.